Well, another question we got is, how do I correct a right foot that turns out farther on the right side than the left? So what I'm assuming this means is if a patient's lying on the table, and my hands would be their feet, that the right foot is turned out farther on the right side than the left. In those patients, there are a number of reasons why that could be. One of the things we do is we do a foot turn-in test to see if they're equal or not. Many times they're unequal, so the foot that turns out farther sometimes doesn't turn in as far. The postural analysis of the patient supine, looking at their feet, would sometimes give us a clue that one foot turned out farther than the other one. It would parallel the foot turn-in if we were to do that. And there are a number of things that people look at, and historically people would look at the balance between the psoas muscles. And anytime we're looking at the psoas muscle, of course, we also have to look at the fact that there could be a foot subluxation or some such thing as that. And then further, the piriformis muscle can also contribute to that. Now, these are some historical factors that people have looked at related to the psoas muscle and the piriformis muscle, but we have to look in a bigger context than that. I'll get to that in a second, because I do need to say also there could be anatomical reasons why a person could have a foot turnout unequal or a foot turn-in unequal. We do the foot turn-in test, and that could be hip arthritis or other kind of arthritic changes, or it could be just some anatomical variant as well. It could be structural from their way they're put together, or it could be pathological. So the giving the anatomical possibility some credence. The thing we need to look at is we need to look at the fact that the psoas and the piriformis or any other muscles that affect the foot turn-in, foot turn-out have to be looked at as part of a larger context and looking at how they're part of the whole body. And one of the failings of applied kinesiology and many therapies is they look at only the local problem and don't look at the greater context of that local problem. And so what we find is if we take a person who has a foot turn-in that's unequal or a foot turn-out that's unequal, in sessions, in steps, I should say in QA session 14, we talk about the endocrine system, we talk about centering the spine, and we see that many times the foot turn-in, foot turn-out pattern is associated with a lateral flexion of the spine. So if laterally flexing right or left related to adrenal or thyroid or endocrine imbalance. And if you take a patient and you measure their foot turn-in, it's asymmetrical. And then you put the person in a lateral flexion, head and feet to the left, for example, and remeasure it, and it's equal. And then you put the patient head and feet to the right and remeasure it, and it's worse. This tells us that that foot turn-in is in a context of a much greater imbalance, which in this case was be related to the endocrine system. So correcting the right foot that turns out farther than the right side than the left may be something you can do by looking at the psoas or the piriformis muscle. And it could be local issues, but more often it's part of a greater problem and more of a systemic issue that we always look at the systemic issues in QA first, as you know. Carrie, anything to add to that?
Just one thing, and that is when you identify these kinds of imbalances, thinking about it in a systemic framework provides you a measuring device to see as you've resolved some of the systemic influences that are burdening the patient. You'll be able to use that to demonstrate both to yourself and to the patient that there's a change that occurs structurally, because as you all know, whether there's biochemical influences or structural influences or emotional influences, they all coalesce in one area of the brain. And in that area of the brain, they influence each other. So sometimes when you don't know exactly where it's coming from, and when it many times is systemically driven, you go through the process of treating the patient with the QA clinical protocol, and you unwind these barriers to proper function, and the foot turn-in normalizes in the process. And you can use it as one of those measuring devices, just like one foot standing or measuring pain. It's another place to measure, 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 just as Dr. Goodhart has taught us.